Hello everybody. We're just going to tell a little talk about gastroenteritis first session today. It is a very common things in children's, but we have to learn a little by little about it so that it increases awareness among us. So gastroenteritis is a transient disorder due to any infection from virus, bacteria, most common virus, but bacteria, parasite also can cause it, and it causes sudden onset of diarrhea with or without vomiting, or it can be also by that is diarrheal disease of rapid onset with or without nausea, vomiting, fever, or abdominal pain. So now it can be also from food poisoning, and acute diarrhea means it should be at least 3 or more episodes of liquid semi-liquid stool in 24 hours and last for less than 14 days. But if it is more than 14 days, then we can tell it prolonged diarrhea. And of course there can be blood with this stool, then we call it dysentery, and that time it usually accompanied by fever, abdominal pain. And travelers diarrhea, sometimes you travel to some of the countries high low income to lower or middle income country, so and you come with these symptoms like then we call it travelers diarrhea. And of course antibiotic can cause also this type. So there is different way we can suffer from diarrheas. And of course we have to know that it is very important to treat the children quickly, because they can have dehydration and kidney problem or blood related problem from that. Most common is dehydration. So let's see how we can just like you have to in the primary care, a child can be managed a little bit. I start today, then after that you can also think when to take to other higher care for that child. So if the child not need immediate hospital admission, then we have to think about that. But you have to pick up your child, it needs immediate admission to the hospital or not. So if the child systematically unwell, and if it is showing the severe dehydration, you can see the child is not passing urine, looks very lethargic, not able to eat and drink anything, of course it's green vomiting, continuous blood coming in the diarrhea, so definitely it needs emergency hospital admission. Of course you have to think about admission also if it is you thinking that it is inadequately responding to oral hydration. If you're giving orally, it's not responding to that, and of course if the child has an underlying condition, they increase the risk of dehydration. And of course if KRR or cannot monitor condition and not can provide appropriate management safety at home, in that case you have to immediately think to admission of that child. Sorry. So now in this case, when you think this, no, it can be manageable in the hospital, then of course there are a lot of resources available for your child to take care of your child, like information leaflet in patient information website, gastroenteritis in children. And of course you have to think about diarrhea and vomiting. NIHS has given very important do and do not guideline. So in do is have to stay at home, get the plenty of rest, drinks a lot of fluids, water or squash, and if it is a child is vomiting, give small sips, carry on breast or bottle feeding. But if they become sick, then you have to give frequent smaller volume and frequently. Then solid food or formula, you have to give in very small sips of water in between and give other formula and solid feed. And when they are looking better, then can give them something to eat. And if your child is uncomfortable, you can give some paracetamol That is the do's. And don't is do not and do not have food juice or frigiding. That pre-G food is not allowed, and fruit juice is not allowed. It makes diarrhea worse. And do not make the formula of baby weaker. Give it in as it is its usual strength. Do not give children under 12 medicine to stop diarrhea. Do not give aspirin less than 16 years of child. And of course, you have to stop spreading infection, wash the hand, soap and water, wash the clothing and bedding that has poo and vomit, clean the toilet seat, flush the handles and taps, surfaces and door handle, everything. So this is a little bit informations. We will continue this discussion in that our later sessions. Hope that will help you to keep your child in when they are suffering from any gastroenteritis. Bye bye for today.